is just a huge honor for me today to be podcast interviewing Bob Brooks, CEPA CBI. That stands for Certified Exit Planning Advisor and Certified Business Intermediary of Practice Endeavors for Brokerage and Practice Endeavors for Real Estate. He is the great nephew of Dr. Willoughby Dayton Miller, PhD, DDS, MD, Science and Doctorate in Science, SCD. He was the first dental microbiologist ever, right there in Ohio, where in fact, he lives. I'll get back to that. I should read all your other stuff. But my gosh, he is an Ohio licensed real estate broker specialized in serving dentists. He continually works to meet the rigorous standards of these organizations and completes many hours of continuing education. He is an instructor in the IBBA's Dental Practice Broker Credentialing Program. He has served as program coordinator for the National Practice Valuation Study Group. He is an active member and regular presenter with the Ohio Business Brokers Association. He has developed proprietary patent pending tools to better serve his clients and assist them in fulfilling their dental practice goals. His dental practitioners have benefited from Bob's non-clinical CE presentations throughout Ohio. He excels at what he does. He enjoys seeing his clients with satisfying and profitable incomes. He's obviously a graduate of the Ohio State University with a BS in '79 and played first trumpet, spending time with his wife, Rindy, 4 adult children, 8 grandchildren, enjoying river life in Florida and playing concerts throughout Ohio with the OSU Marching Band alumni to fill his leisure time. It is a great honor to bring Bob Brooks onto the program, whose family tree has been serving dentistry since 1853. That is an amazing family tree you have there, Bob.
Yeah, well, I probably don't look that old, but that was when Uncle Willoughby was born. So as you said, he was the first dental microbiologist, and it's kind of been fun to have dental historians from around the world come visit our location here in Ohio to get a little dental history and information about Uncle Willoughby Dayton Miller. He removed teeth from the Queen of England, used nitrous at that time, which was unusual. He was Kaiser Wilhelm's personal dentist in Germany. He was a golf champion in Austria. Kaiser Wilhelm wanted him to renounce his American citizenship and become a German citizen. And instead, they sewed the diamonds. They took their wealth home by sewing diamonds into the seams of their garments and came home. And he bought the property where our office is now located. And he was named dean of the dental school at University of Michigan, but he got appendicitis and died of a burst appendix before he ever took that position. And a statue of Uncle Willoughby stands on the dental campus at Ohio State, although he never went to school there and he never taught there. So that's kind of interesting.
Wow, and that was a very special time when they were just coming on to the understanding that there was this microbiological world that they couldn't see with their eyes. Talk about that, and that, I mean, this was the largest pivot of dentistry. I mean, when they realized there was something they couldn't see causing all these problems, and he was the first microbiologist in dentistry.
Right. You Google his name today, he comes up number one.
Yeah.
Yeah.
I mean that is just amazing. I posted some long articles on him on Dental Town history, and some of them I want to take credit for this were on microfiche. And I literally had to look at a microfiche and type, but I put all the words in there because I couldn't find it on the internet. And I knew my homies don't have enough time to do that. But I spent, preparing for your lecture, I must have spent 3 hours typing out what I could find of him on microfiche. And it's just crazy. And I didn't realize how much Ohio and Pennsylvania had to do with the biological revolution that went on around the world in dentistry.
Yeah, it's amazing. And the interesting thing is, even though I'm related to Dr. Miller, Uncle Willoughby, as we refer to him, that has nothing to do with how I got into this line of work that I'm in. So it's an interesting aside, but it gives me street cred, as I like to say.
Well, it does. I mean, it's just amazing. And then his partner in crime was over in Philadelphia, Ned Williams. And I mean, I think Ned Williams and your great uncle. I mean, that was the biggest pivot in dentistry, and the germ theory and all that stuff coming out, and wow, those were interesting times. I wonder what we will look like 100 years from now when young dentists, and could you imagine in 21, in 100 years from now, how silly do you think? I mean, do you think you'll look at us right now thinking we were just like sophisticated cavemen, cretins, and didn't know all about this and that?
Well, it's interesting. I think people who are alive um, and tend to think that they're smarter than people who have gone before them. And I think as we look at people in history, there are some very intelligent people, perhaps more intelligent than us, that accomplish great things. So it's interesting to have a different perspective sometimes.
Well, I want to jump right into the heart of the story, and that is, my gosh, the reason I called you to come on the show. I've lectured for for the Ohio convention, and everything. I know you're a legend out there, but this pandemic is a legend. I mean, this is a once in a century pandemic, and what I noticed on Dental Town is we started that in '99, and it's had free classified ads. One of the best parts of the website is robust, and it's always had about 1,000 offices listed for sale where some dentist trying to sell his practice, and about 4,000 ads to hire a young dentist or associate to help out at the practice. Pandemic comes out, boom, instantly goes to 2,000 dental offices for sale, with all these older dentists saying, forget it, man. I'm not doing the PPE. I'm not going to get the air purify. I'm just so done. I'm just out of here. I'm going to sell it. And then the 4,000 ads to come work for me as an associate has dropped to 1,000, and the only people hiring are DSOs. And I think this pandemic has been the strongest marketing branding exercise for DSOs, because obviously so many dentists decided they were not going to face this pandemic by themselves, and there was safety in herds. And my friends that own DSOs, their phones been calling off the hook saying, I want out, buy my practice, take me over. How do you see it in Ohio? And I really want to know, because Ohio, if you're from around the world, I mean, you got the Northeast coast, you got the California coast. Ohio is just the gold basket center of middle America. What does it look like to you out there in middle America, in the practice transition business? Are you seeing a bunch of old people calling you up and say, Bob, I'm so out of here, sell my practice? What are you seeing?
Well, we've seen a little bit of everything. And I thought that there would be more interest from late career practice owners that had low collections in wanting to sell their practices. And we actually advertised for that to help them for a very low fee and do a patient records sale, into existing practices that are making a full-time living. Because many practice owners late in their career, they've done what I call their practices are what I call lifestyle practices. They don't know what they're going to do with their time, and they just keep hanging on. Their collections go down and their skill sets go down and whatever. But um, there may be a lot of those that have gone out, but I think many of them have unrealistic expectations. They think, well, yeah, I've only got 2 or 3 chairs, and my collections are down to 200,000 or 300,000 a year, maybe less than 200,000 a year. And there'll be a young dentist that wants to buy this practice and come in here. But quite frankly, dentists don't want to buy practices like that. Their best option is a patient records sale, and many of them are reluctant to do that. I think it's a great opportunity for existing practice owners who want to get 1,000% return on their investment to offer $200 per chart for patients that walk in their door. Not just flat out pay a certain amount up front, but only for patients that walk in the door. I think it's a fair return to the sellers, and it's fair to the buyers. And then it's up to the buyers to, identify what work needs done with those patients and to encourage them to stay with the practice. It's not the seller's responsibility. So that's a good out, but I haven't seen, that may have occurred, but I'm not seeing it like I expected to. There are practice owners that are not many of them below the age of 50, um, that have had a good experience being home. And it's like, well, I've got my debts paid off. I've got plenty of money put away. Hey, I kind of like this not working anymore. So we've actually picked up some clients because of that. And they're in no rush to sell. But it's like, hey, we had to stay home during the shutdown. We could kind of get used to this. Um, and then there are other practitioners that have just been laboring under wearing N95 masks and just they're older and they've had great collections and wonderful practices, and they're just wearing out. They're just flat wearing out. And their time horizon, if they say they're going to go another 5 years, it's way shorter. If they say they're going to go 2 years, that means 2 months. I mean, it's really shortened up. So, we've had a significant amount of activity. And as I stay in touch with my friends around the country, brokers in Florida and Colorado and other places, they're experiencing a lot of activity. So there are just some dentists that don't want to keep going anymore.
And what is the DSO activity look like in Ohio? And how has it been impacted by the industry?
Mhm.
Has it been a large part of your business selling practices to DSOs, or talk DSOs in Ohio?
Okay. Well, you may remember at PVSG a couple of years ago, or I guess maybe it was last year, you helped us out in Scottsdale, and Alex Giannini spoke as well. And I have looked at some of the numbers with DSOs, and I remember talking to George Radigan with North American Dental Group back in August. He said we've got 85 practices that we need to close before the first of the year, and we can't take any more practices right now. And of course, COVID put them in a bit of a stall. So you've got this pent up demand by DSOs. You got the pent up demand from private buyers, but also, they can only process so many practices at a time. And the practices we see in Ohio that go with DSOs, a lot of times they're under the radar. You don't even know that they've sold. It's still under the practice seller's name, and there's no big announcement that Midwest bought such and such practice or whatever. The clients that we serve are largely private practitioners, and most of them want to sell to private practitioners. If some want to sell to DSOs, that's fine with us. If somebody is, mid-career or not late career, and they want to practice for many years and they just are fed up with management, DSO may be a good option for them. As you know, if a DSO buys a practice, even if they pay 100% of collections and they hire the dentist to work for them another 2 years, you've probably seen the model where they may actually be better off continuing to work 2 years under their own banner because they get paid on the excess earnings of the practice. They get paid on hygiene. Of course, if they're an associate for the DSO, they don't. So I won't go through that case study, but I think DSO purchases have been backed up and slowed down by COVID because they just can't run enough of them through. But of course, they're probably lining some up for the first quarter, Q1 of next year.
Wow. Yeah, that was so fun seeing you in Scottsdale. It's so amazing how the mind works, because that seems like a million years ago.
Yeah, yeah.
I mean, it's just a crazy how long ago that was. You posted the other day on Dental Town. My column was my Howard Speaks column for November was "Ownership Isn't for Everyone," and you posted something I thought was very profound. You said, "Great topic and valuable insight. One new factor involved with working for a DSO is global non-compete provisions and associate contracts. Our company, which assists in dental practice transitions, recently experienced a deal that was 99.9% complete, but the buyer's attorney discovered a compete in the equity portion of the buyer's DSO employment contract. Based on the information I have, it is my understanding that these non-compete restrictions prevented the associate from owning a practice in any state that this DSO operates in and any state that they plan to enter for 3 years after employment with the DSO. The DSO associate who previously worked for the practice owner who sold to the DSO had no idea that this restriction existed until this buyer tried to buy a practice. It's logical to think that such a non-compete could easily be defeated in court, but the buyer in this case did not want to be the guinea pig. Prospective DSO associates may want to think twice about signing employment agreements with DSOs that unreasonably restrict associates from future practice ownership. My gosh, that is a crazy story, and I've seen that for 30 years. What I've seen in Arizona live and in the courtroom myself was a dentist. If the judge can only enforce the contract, basically the United States court law is that two people can agree to anything as long as it's not illegal, and the courts will enforce it. And they can enforce it or not, but they can't change it. So for this one person who said, their contract said, well, if you work for me, you can't practice in Phoenix for 5 years. And the lady thought, come on, Phoenix, it takes an hour to drive across town. You're telling this guy he can't have a living. I mean, like, I'm in the southernmost part of Phoenix, and it would take me an hour to drive to the most north. So she just threw it out. I saw in a small, but anyway, so if you get too greedy, the judge can just axe it. The judge say, what do you mean you can't work in any state that you're in? I could just see her just saying, throwing it out. But it is a risk. But and then it's different for each town. Like in New York City, a restricted covenant might be 4 blocks because every building is 40 stories tall and has 20 dentists in each one. So, so what are you seeing on these being enforced contracts?
Well, of course, I'm not an attorney. But the distinction was that they couldn't own a practice in any state the DSO was in or planned to go in. Not that they couldn't practice. In other words, they could be an associate for someone else. They just couldn't own a practice. And I think that's the leg they're standing on, is like, we're not preventing you from practicing. We're just preventing you from owning. Well, that's still onerous. And if somebody's willing to step up and take it to court and defeat it, that would be very beneficial to a lot of associate dentists who want to buy practices who work for DSOs. But it's going to take that first one. And the deal that we had going on, the buyer had already turned in their resignation and then became unemployed because they couldn't buy the practice that they were just about ready to purchase because they didn't want to get into a legal dispute with their former employer. And so I don't know where it goes. It's going to be up to somebody that's willing to take on the legal fight. And it seems like it should be reasonably defeated, but who knows?
What percent of your business is in Ohio?
Almost 100%.
Okay. So if my homies are listening to you, you're really, you're for hire to help them in Ohio, but what if they're not in Ohio? How would you recommend that they find a broker that aspires to the things that you believe in?
Well, fortunately, as a result of my pursuit of greater and greater education, I've come into contact with, over 100 people who do what I do across the country. And I've got some connections with some people whose opinion I have great respect for, and I'd be happy to direct them to people who can help them. I think it's important to get connected with the right people, because some people, unfortunately, in every industry, there are those who will take advantage of others. And, this goes on all the time. I think I mentioned in some of the material I prepared for this session with you, Howard, that, sometimes attorneys, they get paid more money if there's chaos. And so they sow the seeds of chaos and make deals much more difficult, sometimes blow them up. They're great attorneys too. So it's just important to get connected with the right people. And I'd be happy to connect anybody who has an interest. I got a email from a friend in the Phoenix area 2 days ago with needed a referral for a broker in Chicago. So, I'm happy to help out and stay connected with people around the country.
And how would they contact you for this information?
Well, by phone or by email. My phone number is 740-924-6294. That's 740-924-6294. Or my email address is bbrooks, that's B as in Bob, bbrooks at practiceendeavors.com. bbrooks@practiceendeavors.com.
Nice. And so do you think this insane pandemic, do you think because there's all this talk about these vaccines, do you think this is almost, are we almost done? I was hearing them talking about their, they could be vaccinating 30 million Americans a month starting next month. What is your thoughts on all that?
Well, of course, I don't have any better idea of how soon the vaccine will be available than anybody else, but I can tell you how it's affecting patients and how it's affecting practices. I was on the phone this morning for, an hour and a half with a client in Eastern Ohio, about 30 minutes west of Pittsburgh. And their collections have been really, really strong. But they did indicate that some people in that practice have been afraid to come back just for hygiene appointments. And but their numbers are still really good and the demand's really good. We saw on the restart, we've got clients that their first month back in Ohio, May 1st, they could start back. We had a practice listing that they did 143% of normal of average in May, 118% in June, 117% in July. And that's been typical. The practices that do a good job of managing information and encouraging their patients and letting them know they're safe, encouraging their staff so all their hygienists didn't quit. There was, I think a lot of the hygienists stayed at home during the shutdown and they all got online and scared each other. The sky is falling. And that's been a challenge for some practices because some hygienists have retired. And maybe some of them were more in the high risk group. And so maybe it made sense for them to do so. But it's been a challenge, and it also caused the late graduation of hygienists who were hygiene students to be able to come into the market and serve as hygienists. So it hasn't affected practice prices. The only way I see that it has lowered practice sale prices would be if there is a seller who has to sell for some reason. And when you have somebody who has to sell, you're not going to get the highest price. But my job as a dental practice broker is to build a market for each seller, which means identify multiple buyers. And then we have not seen a reduction in the sale price of practices as a result of all this. I think people understand that there's light at the end of the tunnel and that we're eventually going to get through this and we're not going to be in this situation forever. And so life goes on.
So we hear so many rules of thumb. I mean, dentists have a rule of thumb for everything. And some of them think that when you go to sell your practice, it's going to sell for 1 year's collection. And I tell them that has to be insane. What if you have two practices that collect $1 a year and one makes 1 penny profit and one makes 25 cents profit? How could two practices collecting $1 be worth the same if one will make you a nickel a year and one will make you a quarter a year? How do you answer that question when people call you over the phone and just say, "Oh, Bob, you've never been in my practice. Tell me what it's worth."
Yeah. Well, any good practice broker is going to, they're not going to give a number. So, it takes a lot of analysis to do a good job to come up with an appropriate number. So there are 3 ways to value a practice. One's the income method, one's the asset method, and one is direct market data, which is comparables. Okay, so the income method, the most common way people look at practice values and the way that most buyers and their advisors look at practice values is just to simply use a percentage of collections. But that's a bad way to value a practice. So, the lender limit, Howard, and has traditionally been around 80% of collections is what lenders will loan for practices. So consequently, that's been the upper limit of what most practices sell for. I realize there are a few exceptions, and we've been involved in some too. I mean, I'm in a deal right now; it's at 96%. So that's been the norm, but that's not what practices are really worth. That is a rule of thumb, just as you spoke of. So there are two other income methods, and they go beyond the scope of this presentation today. One is capitalization of excess earnings. We find that to work about 80% of the time. And I learned this among many other things from my friend Larry Chatterley, CTC Associates in Denver. He's done over 2,100 deals. Also developed this as being the system that is being taught by the International Business Brokers Association and Dental Practice Brokerage. And also Roger Hill with Hill McGill got involved in that, and Roger's had over 4,000 deals. So there's a lot behind what we have there, but the income method doesn't work all the time. The asset method is not generally used, and the comparables method or direct market data method is a good system, but here's the challenge with that. The challenge is that there's no reservoir of information of all the practice sales in the United States, and nobody has got the tiger by the tail on that, because there are over 100 variables that affect practice value. For example, is the practice closed? I mean, did the practitioner become disabled or pass away 3 months ago? Is it a chart sale? Is there an associate in the practice without a non-compete agreement? And the list goes on and on and on. Are there 2 operatories or are there 8? None of these things get reported. What gets reported would be the sale price, possibly the seller's discretionary earnings, and the collections of the practice. That's it. So we can't use that data. So what I like to use personally is I like to use data from the Pepperdine University Business School and the IBBA and some other organizations put together a market pulse report, which is multiples of all businesses in America that have sold. Now, dentistry is far more profitable and successful than general businesses. 9 out of 10 restaurants fail. You look at gas stations, flower stores, manufacturing businesses. It doesn't seem like it would make sense to use those multiples. But being very conservative as a buyer, if you used multiples from that, even using those multiples times seller's discretionary earnings, which is kind of like net income, you take out all the expense for the 4 cell phones for the kids and the $30,000 that's going to mom, and the $5,000 CE trip to Tahiti, and you do all the normalization or what they call add backs, then we call it recasting frequently. When all that's done, the seller's discretionary earnings, if you use the multiples for general business, that actually ends up being very good, a very good multiple to use times seller's discretionary earnings to come up with practice values, and we rely on that quite a bit.
So I'm very impressed by your continuing education and your memberships, and I mean, you're like, you can always tell a dentist who you want to work on you as someone who takes all kinds of continuing education. I met you at a broker's continuing education. You're a member of this, like the Exit Planning Institute. What is things like the Exit Planning Institute? What does that do for you as a dental broker?
Well, actually, the main thing it does is it puts initials behind my name. Most people don't know what a CEPA is. So, they would have to do a little research to figure out what that is. But I want people to understand, even if they don't know what the initials mean, that I've gone through the rigors of trying to be the best in my industry that I can possibly be. And I've learned a lot from general business, from the Exit Planning Institute, and from the International Business Brokers Association that was not dental specific, but what I can apply it toward the dental industry. So it's been very, very valuable, especially International Business Brokers Association, to learn all these things from general business sales and general business brokerage that can be applied to dentistry. I think that many dental practice brokers have too narrow of a focus, and they are not reaching out. In many places, business brokerage is wild, wild west. No CE is required, and you've got all kinds of quality of service, all across the board. So one reason I'm highly motivated, I took one of those Clifton Strengths Finders tests. You ever heard of that?
No.
Yeah, it's trying to think. Gallup bought them out. Anyway, it's called Clifton Strength Finder, and there were 34 different traits. And I took one in 2011, and of the 34 traits, learner came in number 2. I took it, I think it was in 2018, and learner came in number 1. I didn't want it to come in number 1. I wanted something, more exciting to come in, like strategist, or something like that. But I don't know. I guess I always have had an appetite to learn more and more and be the very best in my industry that I can be. And so that's why I jumped into attending practice valuation study group and got involved in helping put some programs together for that group the last couple of years, and why I became credentialed. So I think that's the takeaway is the person you're working with, on the cutting edge of what's going on? Are they working hard to be better? And I just seem to have a natural interest in wanting to do that.
So what is the demand now? I mean, if you go to McDonald's, you get a Big Mac, fry, and a Coke. You go to a dentist, you get a root canal, filling, and a crown. What are most of your calls? Are they older dentists like me at 58, thinking about selling their practice someday? Is it young kids out of school that have had a job for 3 or 4 years? What does your day look like?
Well, I would say that we probably have about 3 to 1 or 4 to 1 buyer to seller ratio as far as contacts to our office.
4 to 1 buyer?
Buyer to seller, right. There are more buyers. Like yesterday, I was at a client's office and I showed him a list of 35 buyers I have for his practice. I'm waiting for him to get me his monthly profit and loss statements for 2020. We don't want to, start to market the practice until we have all the information, and we haven't even established listing price. But there are a lot of buyers out there for practices in good locations. Even if they're not premium practices, there are plenty of buyers in premium locations, and that's mainly in the metropolitan areas and in the school cities. There's a lot of saturation. So, there are a lot of buyers, and conversely, in the rural areas, there are fewer buyers. So, but there's a lot of money to be made in the rural cities serving patients. We like to see, we've always paid a lot of attention to practitioner to population ratios and for general dentistry and for all the specialties. But there are just so many more opportunities in rural communities that if some of these buyers would lighten up and not be dead set on staying where they are, I think that they could find a lot of fulfillment. They could serve patients, and they'd find these communities to be wonderful places.
Well, I mean, it's all around the world. I mean, I just read an article this morning in India. All the rural population, half of India, gets 15% of the dentist, and the other 85% of the dentists are all in the big cities. I mean, they come out of school. They've delayed their mating ritual where, at the end of World War II, they were getting married at 16, 17, 18. They've pushed that back a decade. So they're coming out of school, and they're now a doctor. They're now single, and you tell them to go be as pretty as a peacock in a town of 1,000, and they laugh. I mean, a lot of the DSO captains that have been on this show, like Rick Workman of Heartland, says they're done with rural because when they lose a dentist they said 10 years ago, sometimes they'd wake up and 10% of the rural practices wouldn't even have a dentist working that day. So they're done with rural. So when I hear DSO people say, oh, we're going to be like Walgreens and CVS, we're going to take over all of dentistry. It's like, whoa, slow down, Spanky. Number one, you won't get half of America in the rural because they're not even going there. So now you're just down to the other half. And the free enterprise owner-operated dentist is a tough nut to compete against. I don't even think they can get half of that market. So I'm only predicting the DSOs who are sitting at 12 to 18%, whether you're measuring by locations, number of dentists, or dental supplies. I only see them getting a quarter of a market also because when they come out of school, there's about 6,000 a year, and it takes them about five years So that's 6,000 dentists a year times 5 years. That's 30,000 dentists. It takes them about 5 years to come out of school thinking, oh, I know it'll be great. I'll just go work for someone else. I'll get along. I love taking orders and I'll live happily ever after. And then they quit that job because something's wrong, because they didn't like half of it. And it takes about 5 years before they finally hit rock bottom. And the only reason they lose all their fear of the unknown of going into their own practice is because they have fear of the absolute known, which is dentists, lawyers, physicians are not the type of people who love to take orders. They're always the smartest person in the room. They always think they're the conductor of the orchestra, and it's just a process. So we know rural is bad. We know the millennials want the big cities until they change their mating habits and calls and all that stuff, which isn't going to be anytime soon. So a lot of dentists listening to you right now are two things. Number one, you're saying it's a seller's market, because for every dentist selling, you're saying there's 4 buyers?
In metropolitan markets, there are more buyers than that. That's just the ratio of calls we get every week, which is a question you asked me. But I would say for, good solid practices, with say 4 chairs minimum, doing, 700,000 plus annually in collections, with not a lot of specialty work done in-house. Some of these buyers have more skill sets than the sellers, so there's what I call a production gap there. These practices are more valuable to them if they can keep more work in-house, obviously. These type of practices in metropolitan areas are in high demand, and there will be 10 or more buyers for every practice like that. Now, in the rural areas, if we could get 3 buyers for one practice, we'd be lucky. Those would be rural cities more than an hour from a metropolitan area.
10 buyers for every seller. Now, you've been doing this for how long? Have you been in dentistry doing this?
Well, I've been doing this since 2003, and I may be the first person you've interviewed today that has a degree in dairy science, and that's my background. And grew up on a dairy farm, and the farm that Uncle Willoughby purchased, and came home, took over in 92, which means I went into debt to my parents, and things were going great. We got up to be in the top 1% of the nation in milk production, and I received an International Crop Production Award. And I had also started another business and managed several hundred farm loan accounts for the federal government as an independent contractor, and had a group of people working for me. And I could see that when commodity prices went down, that farmers would just borrow money, and it would reduce their net worth. And we had a big investment in what we had, and things were going great, but I didn't think there was enough return on investment. And I had a few health problems and decided to pivot and change careers. And I got into commercial real estate, not knowing I would be going into dentistry. Was introduced to a couple dentists who needed new office locations after I got my real estate license, and I helped them. And then I got pigeonholed as a dental realty guy, and I did that exclusively, helping new startups, relocations, and satellite offices for a number of years. And in the last 12 years or so, I migrated over into practice brokerage and absorbed and went out and chased as much information as I could get to help me be good in what I do. So that's my background and my history there.
Well, in your 20 years, how does the seller's market, buyer's market, how does it look today, 2020, in a pandemic versus a year ago before the pandemic versus 20 years ago when you started?
Well, 20 years ago when I started, there were still a lot of good startup locations for young dentists in metropolitan areas in Ohio. And we developed some studies and some tools to help dentists decide where to go. And the ones that followed our recommendations did really well. We did about 3 to 5 times the national average in gross collections, first year collections for startups. Help practices that were doing, usually 700,000 or more in gross collections their first year. Some double that. I think we were helping them make some good choices, but we filled up all those spots. And so those opportunities don't exist anymore. And, it on occasion that there's a new development in a metropolitan area, maybe there's a new location that would work for a dentist, but by and large, the metropolitan areas are saturated with dentists. So I would say it's driven more young dentists who want to own a practice, undoubtedly driven more into wanting to purchase practices and increase the demand for practices for sale. And I think COVID just simply delayed everything. There's maybe pent up demand by patients in individual dental practices to get back to the dentist if they weren't afraid of going to the office, and that's why some of our offices had such high collections in May and June when they first started back. But I think there's pent up demand for practice buyers and sellers, where there were some sellers that those practices normally would have gone to market, but they couldn't go to market. I think Bank of America even stopped lending for practice acquisitions, and there was just too much uncertainty. So you have sellers that wanted to sell or were thinking about selling that got held up. So now that gets added to the normal, number of practices that would normally be available for sale. And then there was also pent up demand by buyers. Buyers would have purchased practices back in March and April and May, but they just got cold feet. And so, that there's as much or more traffic and practice transitions now as there ever has been.
Well, in real estate, like right now in Ohio, what would you say for a residential home to compare? What would be the most liquid home for sale? Would it be a 3-bedroom, 2-bath? Would it be 4-bedroom, 3-bath, 2-car garage? What do you think is the most liquid home for sale?
Well, I am a real estate broker, but all my clients are dentists, and I only do commercial real estate, and I wouldn't be a very good person to ask that question. I don't really know. I don't follow that.
Okay, well, so I was trying to make a comparison to what is the most liquid dental office for sale. Is it a 3-bedroom, 2-bath, 2-car garage? Is it 4-bedroom, 3-bath, 3-car garage? Is it 4 operatories, $750,000 a year, 1 doctor? What dental office in the urban is the most liquid?
Minimum 4 operatories. And I tell you, practice buyers love buying real estate. So if the real estate's available, if it's freestanding space or if it's condominium space, that's highly desirable. We don't lack for desire. We don't lack for demand. So, but the most marketable ones, obviously, like I said, are in metropolitan areas. All digital is, a buyer can come in and they can buy new equipment. They can buy technology. And some of the sellers say, well, I'm not going to buy a digital pan because if the buyer wants to buy one, they can buy one. I'm ready to sell. I don't want to buy one. And they can say that, but quite frankly, if a practice is all digital, especially if it's all paperless, then, that is a more desirable practice. So I would say 700,000 and up. Really, I think anything 6,000 and up 600,000 up would be good, because if you stop and think about it, Howard, if somebody's going to buy a practice and it's a private practice purchase, they want to have enough income that they can pay the loan on the practice, pay off their student debt, put groceries on the table, and make it. If you've got a practice, and I suppose it could be sharply different in different parts of the country. The cost in New York City are going to be way different than they are in Ohio. But if you, at least in Ohio, if the practice is collecting 600,000 or more, the pie is just not big enough. So that's an issue. And then you've got the whole thing about, if it's a largely fee-for-service practice and you're going to have better patient retention if the seller stays on, then the pie needs to be even bigger if you're going to keep the seller on for a while to maximize patient retention. You're talking, 1 million and above, at least 800,000 above for the seller to stay on a little while and get paid as an associate. So that would be the sweet spot for practice deals in Ohio, would be that 4 to 7 operatory, 700,000 to 1.2 million, all digital. That would be it.
Have at least 4 operatories and up to 7 operatories?
Yes.
And collecting at least 750,000 a year, but up to how much a year?
Oh, whatever. Part of it depends on the current production of the buyer. if they're cranking out $1 million a year now, obviously they can buy $1 million practice. So I talked to two dentists this morning. One is producing $200,000 a year as an associate. Bad. Okay, we got another one producing $1 million a year. Okay, so they can buy different size practices. It's going to be dictated by the lender. The lender's going to have some say in that.
But just a range, 750 up to
one and a quarter. Is probably what a lot of buyers could handle on their own. It's going to be hard for a buyer to buy a practice without it. They could buy a practice larger than that has an associate. You certainly go up to 2 million. And that would be maybe a first time buyer could buy a practice up to 2 million. If they're a super high producer, they could possibly, and with no debt, they could possibly do it on their own. But those are going to be the rock stars.
Well, you said the most profound thing to me when you mentioned the production gap, because 32 years. In fact, I've been seeing this forever. I mean, a dentist will go buy a practice for $1.25 million because he thinks this dentist, these full mouth cases are just, basically just a bunch of crown and bridge and all that, and he can do it, but he doesn't realize he can't present and sell a case that big. I mean, when we look at sales case, I just hound one number over and over and over for my for the last year, and dentists don't. It's a different culture. They don't like the word selling. They tell you they don't like the word selling. They tell you they don't want to be a salesman. It's like, okay, Spanky, you are going to believe whatever you tell yourself. But the average new car price in America is $33,560, according to Kelley Blue Book and USA Today. And the average American will buy 13 new cars by age 76. Well, I guarantee you 95% of all the dentists in America have never sold one case for the price of a new car, which their patients will buy 13 of them. And they'll buy 13 new cars in their lifetime in Ohio. And the insurance companies, Delta Dental and Blue Cross and Blue Shield, aren't going to buy you your car. And you buy it with your own money. And they always offer financing. Only 10% of the cars are sold in cash. 90% are financed, usually for 60 months. And my boys is like, I don't do that. I know you don't do that. But when you go buy an office collecting $1,250,000, because that boy in there knows how to do it, and he works 4 days a week, but Friday is the big case day. And my God, they won't even do the anesthesia because they don't want the liability of all that. They have an anesthesiologist come on, they put them down, and then the patient's it says, oh my God, if you're going to put me to sleep, do the whole case. And they don't say, oh, your case, Bob, will be $33,000. They say, Bob, we could actually completely redo your mouth. You'd have a Hollywood smile for just $480 a month for 60 months. Bob, does that sound like something you want to commit to today? And Bob's thinking, $460 a month to have a movie star smile? That's the same feeling he gets when he's bought 13 new cars. And then you go buy this big dog practice, and yes, you can prep a crown and you can make a temporary and you got a good lab, but you sure as hell can't present and sell and close and collect on a $33,000 case. I know dentists who've done it every Friday for 3 or 4 decades, and they're in a medical dental building with 8 other dentists who have never done it one time in their life. So the production gap of not being humble enough to know what the hell you don't know. Everybody is always going to tell you what you know. I mean, the minute you meet some people, they're going to let you know all the things they're the most proud of. But dentists, physicians, lawyers, they never tell you what they don't know. Another thing is, what are they referring out a year? I mean, is this guy referring 7 molars a month to an endodontist at $1,000 a piece and you love molar endo? Or does, you got to match this stuff up. And the number one genius I ever saw in my life was back in I think it was 1990 in Palm Springs. Me and my buddy Mike Totola, we've laughed about it for 30 years. This young dentist friend of us, and he didn't think he had enough money to buy a big practice. He didn't think he could buy $1 million practice. So he thought, he could only afford a really small, cheap practice. And he found some 70-year-old guy in Palm Springs that didn't do root canals, he didn't do anything. He just patched everything with amalgams, and he had this little patching amalgam practice for 50 years. And this guy buys it, and every single day for the rest of his life, four patients come in with some MODBL amalgam patch job for 30 years, crumbles apart, and all he would do is give a block and do a single unit crown, make it temporary. He did 4 crowns a day, Monday through Thursday, his whole life. I mean, he just bought the perfect practice. And so that's a case where he bought this little nobody nothing practice, and it was $1 million practice with no work, no effort, just nothing. So knowing what that dentist is producing, collecting, diagnosing, referring, and being humble enough to look at that skill set and say, do you have this skill set? Can you do what this is? That's a big part of the deal.
Yeah. Yeah, so we call that the production gap. And so we actually look at those numbers on a practice. Like, for example, we've got a listing right now. It's in Dublin, Ohio, where Murfield Golf Course is, Jack Nicklaus, and it's a nice community. And this dentist, he has 29 clinical hours per week, and he sends everything out. Need an extraction? It's like, oh, let us make an appointment to go see Dr. So-and-so for you. And he stays right on schedule. He farms everything out. So we take a listing of all the specialty procedures and have the dollar amounts of everything that he sent out. And so then when buyers look at that practice, they can get a good idea of the amount of work that they're going to be able to keep in-house and be able to serve those patients and profit from that work.
So the other thing you said, another thing dentists always want to know is, like, go back to the house. I mean, obviously in Phoenix, if you have a 3-bedroom, 2-bath, or 4-bedroom, 3-bath, 3-car garage. I mean, that range, 3-bedroom to 4-bedroom, that's the range. One of the reasons the NFL players have such high, 50% of them lose all their money and go bankrupt, get for every year they were in the NFL. So if they play in the NFL 4 years, it only takes them 4 years to lose all their money, is because when they get that big paycheck, they go buy a 12-bedroom, 7-car garage with Lamborghinis, and they don't realize that when they blow a meniscus and have to sell that 10-bedroom home, it's not liquid. And people who can buy a 10-bedroom home, they might not want your 10-bedroom home. They might want to just build their own. So it's not very liquid. And real estate people will tell you in Arizona, even though you're in a desert, if you go put 30 grand into a swimming pool, you're not going to get that 30 grand back out of your house. It's not going to raise your selling price for the price of the pool. But you said that digital was a liquid investment. You mentioned digital. What if you're an older dentist listening to you right now? By older, I mean anyone who's an hour older than I am is old. I'm not old, but if you're an hour older than me, you're damn old. What money can he invest in his practice that he'll get his money back and a return on investment and make his practice more liquid, versus that's just not going to do anything to affect the sale? What are the best things to invest in?
Well, you got to put the glasses on, look through the lenses of everything that generated the numbers for that practice is what that buyer's looking at. And the technology that's in that practice now is what was used to generate those numbers. So you have to keep that in mind. When a buyer starts saying, well, they don't have digital rate, they don't have digital pan. Well, yeah, this was generated without a digital pan. Okay. So if you want to turn in insurance claims and be able to use that radiography in a different way, that may improve, that's going to improve your efficiency and all that, but that's not what the numbers represent. So I would say it's kind of on a timeline. So if a practice owner wants to sell in the next year, there's probably not a lot they can invest in. I had Josh Austin come in. He's a dentist in Texas, and he spoke about some technology once. And there's some low dollar ways you can get uh, technology that you can say that you've got digital radiography, maybe get into it for $30,000 without costing an arm and a leg. So if somebody wants to sell today or tomorrow, an investment is probably not worthwhile. But if you're going to be in practice for at least another year or two, you really should be digital, and you don't have to have. I'm not a person that's going to tell you if you should have the Nomad unit or you need to have the bite wing arm in every operatory. I mean, that's more clinical. That's not in my wheelhouse of expertise. But I can say if you can do some low dollar investment in digital radiography, that would be well worth it. Now, some practice owners think they know what they need to do to spruce up their offices, and they may be correct and they may not be correct. We've got a seller in Northwest Ohio that I think they put new carpet down in all the operatories and walk hallways and administrative areas. And, I never recommend carpet. I mean, it's not up to me, but I prefer not to see carpet in operatories. So sometimes they do things that they think are helpful, but they're not really helpful. So it's like you said, Howard, people don't know what they don't know. And sometimes dentists, they don't want you to know they're not willing to admit what they don't know, and they're not an expert in everything. But if they would, seek out some qualified advisors that could help direct them, I think they could save cost, and whatever they do invest, they can invest it more wisely.
Well, I got to tell you the carpet story where it's just so ridiculous. It's hard to believe, but going back to, I got out of school at 87. It wasn't 87, 80. I think it was 89. A buddy of mine bought an old guy out in Phoenix, and he called me up and he said, hey, will you, any chance you come over Friday night and help me rip up this carpet in the dental office? We're going to tile it over the weekend. So I went down there with a couple of my babies. I forgot how many I had at the time. I know I had at least 2 or 3 because I can remember Eric playing with it. But we pulled up that carpet, and we each had a couple of babies running around, and they were kicking the balls of mercury that would roll into the wall and split in two. It was like billiard balls. And this guy had this carpet forever. And it was balls of mercury the size of dimes, nickels, and quarters.
Oh, man.
And we were actually shoveling these balls of mercury. And of course, back then, what did you do with it? It's not like you took it to some intelligent place, but it was just another crazy time. But after I saw that, I can assure you there should never be carpet in anything that has to do with infection control. And by the way, dentistry is an embarrassment. Your great uncle would be embarrassed today because I had this happen to me where I went to Chandler Memorial Hospital with a surgeon, and we park in his little sports car, and he's got his ASIC shoes, and we walk across the parking lot, go in the elevator, go up, and he spends 15 ridiculous minutes washing his hand like it's some religious cult, and then gloves up, and he goes in to do surgery, and he thinks he's all sterile. And then you go across the street, and a patient of mine got me an Intel tour. And Intel, God, everyone goes in a room. They take off all their clothes. They get in a uniform. They go in another room. They're wearing, looks like they're walking on the moon, breathing through respirators. The air is filtered at 1 part per billion. And the quality sterilization, infection control, zero tolerance to Six Sigma is when they're making a chip for your iPhone. And then you go across the street to the hospital where the one thing doctors never want to talk about is how many patients die in their system each year that has nothing to do with their disease, and they're not transparent about it. And the CDC has tried to get them to be more transparent, but estimates that 200,000 to 300,000 Americans die each year when they go to their hospitals. And the fact that when grandma's in the hospital, that her children and grandchildren, think about it. Phoenix, Arizona, 3.8 million people, everybody dying of some god-awful disease is all in one building, and you decide to take your 3 kids to go visit someone dying in that room? Are you completely out of your flipping mind? And then these kids, the rest of their life, they have MRSA, they have this and that, polyphagia. By the time you're on 5 different prescriptions, you're dropped dead all the time. That's my biggest fear of free healthcare. When I hear Canadians saying, "Oh, our healthcare is free," dude, it's a machine that eats 300,000 people alive. Would you like me to give your grandchildren free tickets to go to a carnival that kills 300,000 people a year? I mean, hopefully this COVID-19 thing will wake people up. Hopefully they'll just ban anyone visiting a hospital unless you're sick and dying and actually have to be in there. And then when you read American literature, I mean, all the smart people a century ago all said, I don't care how sick you are, don't go to the sanitarium, because, I mean, they didn't know the microbiology theory before, your great-great-great-grandfather, and people would deliver a baby, then go amputate a foot, and they looked at the mortality rate of having your baby in the hospital versus at home, and everyone that could read or think independently knew to stay the hell out of way of there. And a century later, it's not even that much better. It's still a disgusting cesspool of infection. They don't even try. And that's why when they were talking about closing down dental offices for this pandemic, I'm like, dude, we dealt with HIV 30 years ago, and we're a league ahead of so many places, including many wings of a hospital. I mean, you just sit there in a hospital thinking, God, I would never allow this in my dental office, just opening drawers and cabinets with their gloves on and all this crazy stuff. So young kids, they I don't know what's different about millennials, but they're different. I mean, they're having less. They get married a decade later. They have half the number of kids. They don't work for one company for life. Like my mom's brother in my backyard here, he got a job at Mobil Oil when he was 16 and he retired there at 65. They don't do that. I mean, all over Wall Street, the millennials only work 1 to 2 years, and then they change jobs, even among FANG stocks, where they're throwing the most money at them, stock options, everything they've got. Facebook, Apple, Netflix, Google, Uber, they just throw everything at them, and they only stay 1 or 2 years. And that's what I see with associateships, and it seems like it takes them 5 years of having 5 to 7 horrible jobs before they finally say, screw it, I'm going to work for myself. Is that how you see it, or do you not see it that way?
I do see it that way, and I think there's a reason for it. When I used to present to dental students a decade ago, I would ask them, how soon do you expect to own a practice? And the consensus was the majority was about 2 years. And over the last several years, when I ask the same question, the response is 5 years. And I think that corporate dentistry has gone into a lot of schools and basically shared with students that, they're going to have so much student debt, it would be wise for them to take an associate's position with their company, and they can't afford to own a practice. And that's not just me guessing, that's been repeated over and over by many dental students to me. Now, I was working on a practice today, and after a buyer purchases this practice and makes the practice loan, the seller's discretionary earnings pre-tax is going to be $468,000 a year. Okay, so can you afford to? You need to work for corporate dentistry because you can't afford to own a practice. You're going to make 120, 150, maybe 180,000. I realize there are a few that make more than that, but you can better afford to make your student payments making 150,000 a year or 450,000 a year. Which is it? So, but all this has kind of put fright in them, some fear, and so they've just simply delayed. And there are dentists that are practicing right now that there was an older practice owner locally a couple years ago that was actually wanting to buy another practice, and he and another dentist were talking, and they asked each other how much tuition was when they first started dental school. And this one dentist who wanted to buy this practice that we had listed, it was $1,000 for the whole year. Dental school was $1,000 for the whole year. And by the time he graduated and High State was on quarters, and it was $1,000 a quarter. And now you know what the debt level for students is. So things have changed a lot. Part of it's real, part of it's perceived concern. but I do see them working in other practices once they learn the practice management aspect of things, and they end up doing some of the administrative work that their employer, that maybe they don't even get paid for. It's like, why am I doing this? Getting paid this much, I could be doing it for myself, making far more.
And when you're in like practice valuation groups, and I always find it interesting how different dentistry is than other types of practice. Tell my homies the difference between like selling a medical practice if they would have been a physician instead of a dentist. It's a different beast, isn't it?
Right. So much of medical is controlled by hospitals now that they're just there's not the opportunity. I think a lot of bright minds have gone into dentistry that might have otherwise gone into medical because the income and the liability in medical is lower income and greater liability. And so maybe that's why they chose to go into dentistry, into medical. So we've I've assisted some medical practices in real estate, but I haven't sold medical practices, so I'm certainly no expert in that. But I do see that that obvious choice that some students are making to choose dentistry over medicine for those reasons.
And so banking, it all comes down to the bankers. And my gosh, I actually liked it better in the old day because in the old day, the seller carried the paper. So you'd agree that you're going to buy this practice on $1. They always charge 10% interest for 7 years. But that dentist was involved and he was incentivized because he wanted you to be successful to pay the mortgage each month. So if you had a problem or an upset patient, he had skin in the game. But now you're just selling to a stranger, and you're just going to take the money and run. Do you think that's a better system, or did you like it better in the old day?
When you get down to it, money is about little green pieces of paper with pictures of dead presidents on it. So it doesn't really make any difference where it comes from. And you're going to owe somebody. So for the sellers, it's a good deal if they can get their money and get out of it. But here's the dirty little secret. I shouldn't call it dirty. It is, it is something that people don't talk about too much. And that is, I think that dental practice lenders, and I get along great with them. I was a moderator for a group of the top lenders here in the country a little while ago. The IBBA, the International Business Brokers Association, hosted it, and I moderated it. And I get along great with these folks. But they understand that just because a lender will loan X amount for a practice doesn't mean that's what the practice is worth. So there are three sources of money to pay for a practice. You've mentioned one of them, seller financing. The other one is take money out of your bank account. And the third is, from a lender. I think that lenders are financing typically, around 80% of what practices are worth. And that's what a lot of them sell for because it's 100% seller financing. If practices really sold for what they were worth, we'd see a lot more sales in the 100% range, and there would be a little seller financing involved with it because lenders don't want to take that level of risk. You stop and think about level of risk. If there's an SBA loan, Small Business Administration loan for anything, let's say it's for real estate. If you're going through an SBA lender, then the lender's going to finance 90% of the loan. If it's a conventional lender, they're going to finance 80%. In other words, they're not going to finance 100%. Lenders don't generally finance 100% of what a practice is worth. Lenders don't establish the value for practices. They just see if the number that the buyer and the seller agree on will cash flow. They're cash flow lenders.
So right now, that's the other question. I'm sorry we've gone over an hour and I still got so many questions for you. I'll try to wrap it up pretty quick. But the dentist one of the first things they always ask is, well, if I'm going to buy this thing and I'm 25, I don't want to pay rent till I'm 65. I want to own the real estate. And then you get into the question where, are you in the real estate business or are you in the dental business? Maybe renting next to a busy grocery store for 40 years is better than going 3 blocks down the street off the 4-lane intersection and owning the land and building of this little house. How do you coach And plus, the thing that we both have in common is people are very emotional about dentistry and pain and all that stuff, and people are very emotional about finances. They never want to talk money or finance and all this stuff like that. But I think when they want to own their land and building of their practice, it's a very emotional reason more than it is a financial, logical reason. How do you advise them on that complicated thing?
Well, of course, if a buyer is going to purchase a practice, the practice, the office could be owned by the practice seller or not owned by the practice seller. And if that property is leased and the lease is reasonable, we don't, the KPI, key performance indicator for a real estate cost is 5 to 7% of collections. If that's in that range or lower, then they're good to go. If you're gonna make a good living from this practice and it's a great investment, even if it's leased property, you can smile all the way to the bank. You don't have to own that property. Conversely, if you look at what a real estate loan would cost you versus a lease payment, if you have the option to lease or purchase, I can see why somebody would want to purchase the real estate because their real estate cost might actually be lower per month than what their rent would be. And they would control their own fate and they would establish some equity in the property. So that makes sense as well. Now on a lease, of course, the lease has to be assigned. The assignor is the practice seller and the assignee would be the practice buyer. So the assigner is not the landlord. Landlords don't assign leases. The practice sellers assign the leases and the landlords have to approve it. So I would highly recommend that when the practice documents are signed and the real estate paperwork is put together, the lease assignment, that the asset purchase agreement for the practice say that the sale is contingent upon the lease of the dental office, and go ahead and get that asset purchase agreement signed. Don't leave it unsigned just because that contingency hasn't been met. Put that in as a contingency. And then on the real estate assignment, the lease assignment, you put in there that the lease assignment is contingent upon the practice sale. That way you can get that document signed. Because as you go to closing on a practice, you want to have everything signed. You don't want to have paperwork that's unsigned because they say, well, we're not going to sign the lease assignment until the practice sells. You don't want to do it that way. Use it as a contingency in the paperwork and get everything signed ahead of time.
Man, I could listen to you for 40 days and 40 nights. I'm just sitting there trying to think of what would be a smart question to ask you that my homies want to know. And I'm kind of running out of what do you, we talked about insurance. I know there's a lot of emotional stuff going on right now because the insurance companies didn't pay for PPE. So now a bunch of dentists say, I'm going to drop insurance. And it's like, okay, well, if you want to see a lot more of something, try to get the government to subsidize it, the employer to subsidize it. Don't ever tax it or regulate it. And if you want to see something, you want to see a lot less of something, raise the prices, tax it, regulate it. But my gosh, the dentists just don't get it. Like I'll say to a dentist, say, well, what's your favorite procedure that you just love to do? And they'll say a crown. And I'll say, okay, what's your crown fee? And they'll say $1,000. And I'll say, okay, well, what are you going to do with the fee next year? I think I'm going to raise it. Oh, so you hate crowns. Because if you raise the price is the most elastic effect on demand. That's why you might have noticed they sell less Porsches and Ferraris than Chryslers and Plymouths. And my gosh, price is so emotional to them. And then the other thing with the young dentists, a lot of the dentists they're so obsessed on the price of the practice. And then I say, well, what is the interest rate on the loan? And they don't even know. And I'm like, well, dude, the interest rate on the loan on a 10-year, 15-year loan could swing the total cost of this loan by hundreds of thousands of dollars. So again, they're emotionally locked in on the practice price because they don't know the total cost of the asset transfer with interest. I mean, it's just an emotional subject. I mean, it's just tough. But is there anything that you thought we should talk about today that I didn't bring up?
On insurance, I would say that it's important for a buyer to know if they're going to be able to take on some of the insurances that the seller has. For example, in Ohio, no buyers can pick up Delta Premier. Well, Delta Premier has a higher reimbursement rate on a lot of procedures. So, buyers might want to discount the collections of the practice a little bit if they're, comparing what they could expect compared to what the seller was producing. Also, buyers should be aware that the it's important for them to get credentialed right away if they're going to buy a practice, because a lot of times it takes longer than they expect. Even if they got the same insurance where they're an associate in another dental office in the area, they think, oh, it'll be nothing for me to get credentialed. Don't. It's a whole new ball game if you're going to be an owner. So they need to get after it. And as far as what you said, Howard, about being price obsessed, it is more buyers. The majority of buyers come back to me, when it comes to price. And I'll tell you right now, we sell most of the practices we have listed at list price, which, I think is very reasonable, because when I come up with a valuation, we don't call them valuations. We call it most probable selling price. It should be the same for the buyer or the seller. We don't inflate it because we're working for the seller. We want good numbers to substantiate that price. And so, they'll come back and they'll say, well, I think it's too high, or my advisors, same thing you said, they don't even know what the interest rate is. They have no basis. So if a buyer is going to contest a price, they need to do their homework. They need to have the numbers to back it up. They're not out buying a $20,000 car. You just can't talk about the blue sky. You've got to have some foundation for what you're claiming. And the amount of money, if a practice sells for 50,000 more, 50,000 less, over the life of that practice, they're going to be making millions. And are they going to blow up a deal, or are they going to let their CPA or their attorney blow up a deal that it could be the most wonderful opportunity for them, just over a small amount of money? So they do tend to be price obsessed, and I think they need to back off.
Well, it is an emotional topic, and I thought it was just amazing having you come on and talk some common sense. Common sense isn't very common, but I've known you for a long time, and you are an amazing man. And thank you so much for coming on the show and sharing your thoughts. And you said people could get a hold of you by your email and your phone number. So it's Bob Brooks. So it's B Brooks at practiceendeavors.com. And just go to practiceendeavors.com and it's right there. But Bob, thank you so much for all that you've done for dentistry and continue to do. You're one of dentistry's 1,000 points of light, and I really appreciate all you've done for dentistry and for coming on the show today.
Well, thanks, Howard, and thanks so much for what you've done and for what you're doing.
All right. You have a good day.
Okay, you too.
Bye-bye.